Health insurance and medical coverage is about to be disrupted in fundamental ways. Some of you are wearing fitness tracking devices. Most of you don't know that you actually have a fitness tracking device in your phone. If you have one of the latest smartphones, it's already measuring how far you walk each day. And the devices that we're putting on our wrists are measuring everything from temperature to heartbeat. In the next 5 to 10 years, we will put some of those sensors into our bodies, measuring everything from liver function to lungs and hearts, and we get real-time feedback on our health. We're also able to track our own DNA, to do a DNA and genetic sequence so that we know which diseases we are prone to and which we are going to be safe from. This information is going to be hugely significant in helping us manage our health. But the biggest implication is that it is going to destroy health insurance and medical coverage. Because health insurance today is based on us not knowing this information. We're put into what the insurance companies call a pool of people. In that pool of people are people who have varying degrees of risk for some of these diseases, a risk of cancer, a risk of Alzheimer's. We don't know who's going to get cancer, so we all share the risk. If it's me and I get cancer, well, you'll help me pay for my treatment. I hope it's not me, and so I'm prepared to pay for other people if they get Parkinson's or Alzheimer's or whatever disease. But what happens if we know? What happens if we know for sure who's going to get Parkinson's and who's going to get cancer? And if I know that I'm not going to get them, well then maybe I'm not going to be prepared to be in that pool. And at that point, insurance and medical cover dies. Whether it's private or social security from your government, it dies at that point. This is what we are facing in the next decade. And I don't believe we're thinking enough about it. I don't hear many governments talking about it, and certainly the insurance companies are not having these conversations with us. The future is coming, and it's a very disruptive future. And we need to be thinking how we as a public, how we as society are going to deal with healthcare, medical coverage, and insurance in the future. The future is coming. Are you ready?